1. What is the first step in the nursing process for making clinical judgments? A. Assessment. B. Diagnosis. C. Planning. D. Evaluation. Answer: A. Assessment. Rationale: the first step in the nursing process is assessment, where the nurse collects and analyzes patient data. This allows for informed decision-making in subsequent steps such as diagnosis and planning. The other options are steps that follow assessment. 2. In prioritizing patient care, which of the following factors should be considered first? A. Patient's emotional state. B. Immediate life-threatening conditions. C. Family requests. D. Patient preferences. Answer: B. Immediate life-threatening conditions. Rationale: the priority in nursing care is to address life-threatening conditions first, according to Maslow's hierarchy of needs. Emotional state, family requests, and patient preferences are important, but are secondary to immediate physical needs. 3. A nurse is preparing to administer a medication. What is the most critical step in ensuring patient safety? A. Checking the medication label for the correct drug. B. Asking the patient for their name and date of birth. C. Verifying the medication order with a pharmacist. D. Performing a patient assessment before medication administration. Answer: B. Asking the patient for their name and date of birth. Rationale: the most critical step in ensuring patient safety is verifying the patient's identity using at least 2 identifiers, name, date of birth, before administering any medication. This helps prevent medication errors. 4. When making clinical judgments about a patient's care plan, what is the nurse's primary role in collaboration with the healthcare team? A. To make final decisions regarding treatment. B. To delegate all responsibilities to the physician. C. To gather data and communicate concerns to the team. D. To ensure patients follow the care plan without question. Answer: C. To gather data and communicate concerns to the team. Rationale: the nurse's primary role in the collaborative team is to collect patient data, assess the patient's condition, and communicate any concerns or changes to the team for shared decision-making. Nurses do not make final treatment decisions independently. 5. A nurse is faced with an ethical dilemma where a patient's family insists on continuing aggressive treatment despite the patient's wishes to stop. What is the nurse's best course of action? A. Follow the family's wishes. B. Respect the patient's wishes and advocate for them. C. Call the physician to make the decision. D. Disregard both the patient's and family's wishes and follow hospital policy. Answer: B. Respect the patient's wishes and advocate for them. Rationale: the nurse must advocate for the patient's autonomy and wishes. Ethical principles like autonomy and beneficence guide nursing practice, meaning the nurse should respect the patient's right to make decisions about their care. Following the family's wishes could violate the patient's autonomy. 6. When assessing a patient's pain level, which method is considered most effective? A. Asking the patient to rate their pain on a scale of 0 to 10. B. Observing the patient's facial expressions. C. Reviewing the patient's medical history. D. Checking vital signs only. Answer: A. Asking the patient to rate their pain on a scale of 0 to 10. Rationale: the most effective and accurate way to assess pain is by asking the patient to rate it on a standardized scale, such as the 0 to 10 pain scale, as it allows the patient to express their experience directly. Observations and vital signs are supplementary. 7. What is the most appropriate action when a nurse notices a sudden decline in a patient's respiratory rate and oxygen saturation? A. Wait and reassess in an hour. B. Administer supplemental oxygen and notify the healthcare provider. C. Change the patient's position and monitor vital signs. D. Document the change and wait for the healthcare provider's orders. Answer: B. Administer supplemental oxygen and notify the healthcare provider. Rationale: a sudden decline in respiratory rate and oxygen saturation indicates a potential emergency. Administering supplemental oxygen immediately and notifying the healthcare provider is crucial for patient safety. Waiting or just documenting could worsen the situation. 8. Which of the following is the most important consideration when prioritizing care for multiple patients? A. The patient's age. B. the potential for harm or deterioration. C. The time since the last assessment. D. The patient's desire for comfort. Answer: B. The potential for harm or deterioration. Rationale: the primary consideration when prioritizing care is assessing the risk of harm or deterioration, as life-threatening conditions take precedence. Age and comfort are important, but are secondary to critical needs. 9. A nurse is about to administer a blood transfusion to a patient. Which of the following actions should the nurse take first? A. Ensure the patient's vital signs are stable. B. Verify the blood type and cross-match with the patient's records. C. Hang the blood bag and start the transfusion. D. Educate the patient about potential transfusion reactions. Answer: B. Verify the blood type and cross-match with the patient's records. Rationale: verifying the blood type and cross-match before administering a transfusion is the most important step to prevent transfusion reactions and ensure patient safety. The nurse should also perform other tasks like checking vitals and educating the patient, but verification comes first. 10. A patient is refusing medication that is crucial for their treatment. What should the nurse do next? A. Administer the medication forcefully. B. Explain the consequences of refusing medication. C. Document the refusal and do nothing. D. Notify the physician and ask for an alternative treatment. Answer: B. Explain the consequences of refusing medication. Rationale: it is essential for the nurse to engage the patient in understanding the reasons for the medication and the consequences of refusal. The nurse should never force medication but should educate the patient to make an informed decision. Documenting the refusal and involving the physician for alternatives may follow, but education is the first step. 11. Which of the following is the most important factor when determining the appropriate care plan for a patient? A. The patient's age. B. The patient's diagnosis and medical history. C. The patient's social media presence. D. The patient's family history. Answer: B. The patient's diagnosis and medical history. Rationale: the care plan should be based primarily on the patient's diagnosis and medical history to address their specific health needs and concerns. Age and family history are factors, but the diagnosis and medical history should guide decision-making. 12. A nurse is caring for a patient who is receiving a blood transfusion. What is the most important observation during the first 15 minutes of the transfusion? A. Monitoring vital signs every 5 minutes. B. Observing for signs of an allergic reaction. C. Giving the patient fluids to help with circulation. D. Ensuring the blood is being transfused at the correct rate. Answer: B. Observing for signs of an allergic reaction. Rationale: during the first 15 minutes of a blood transfusion, the nurse should closely monitor for any signs of a transfusion reaction, which can occur early. Vital signs should be checked, but reaction signs are more critical in the initial period. 13. Which of the following is an example of a nursing intervention that promotes patient safety? A. Assigning care based on a patient's diagnosis alone. B. Using a two-person team to transport a patient with mobility issues. C. Ignoring minor side effects of a medication to focus on more serious ones. D. Not involving the patient in their care decisions. Answer: B. Using a two-person team to transport a patient with mobility issues. Rationale: using a two-person team for patient transport helps ensure safety, especially for those with mobility issues, reducing the risk of injury. Patient involvement and addressing side effects are also part of safety, but not the correct response here. 14. What is the primary purpose of critical thinking in nursing practice? A. To avoid mistakes in patient care. B. To ensure patients follow the prescribed treatment. C. To make informed decisions based on evidence and patient needs. D. To question the physician's decisions. Answer: C. To make informed decisions based on evidence and patient needs. Rationale: critical thinking in nursing helps nurses make informed decisions by analyzing data, considering evidence, and evaluating patient needs. It is not just about avoiding mistakes, but actively improving care quality. 15. Which of the following is an example of a legal consideration in clinical decision-making? A. Communicating with a healthcare team in a timely manner. B. Providing care without obtaining informed consent. C. Maintaining a professional relationship with patients. D. Ensuring the patient has adequate nutrition. Answer. B. Providing care without obtaining informed consent. Rationale. Providing care without informed consent is a legal violation and a major ethical issue. It is crucial to obtain informed consent before any procedure to ensure patients' rights are protected. 16. Which of the following actions would most likely improve the quality of clinical judgment in nursing? A. Relying solely on clinical guidelines. B. Engaging in continuous education and reflection. C. Ignoring patient preferences for treatment. D. Following physician orders without question. Answer. B. Engaging in continuous education and reflection. Rationale. Continuous education and reflection enhance clinical judgment by keeping nurses updated with new evidence and improving critical thinking. Relying only on guidelines or following orders without reflection can limit effective decision-making. 17. What should be the nurse's priority when caring for a patient with chest pain? A. Assure the patient that it's likely indigestion. B. Assess the severity of the pain and obtain a thorough history. C. Administer a pain reliever immediately. D. Call the physician before assessing the patient. Answer. B. Assess the severity of the pain and obtain a thorough history. Rationale. The priority is to assess the patient's pain and gather information to understand its cause, which could indicate a serious condition like a heart attack. Administering medication should be secondary to a thorough assessment. 18. When a nurse is unsure about a medication dosage, what is the appropriate action? A. Administer the medication at the prescribed dose anyway. B. Ask the physician for clarification before administration. C. Check the medication reference book and proceed. D. Consult with the pharmacist and document the concern. Answer. B. Ask the physician for clarification before administration. Rationale. When uncertain about a dosage, the nurse should always confirm with the prescribing physician to avoid medication errors. Consulting with a pharmacist is also acceptable, but it is best practice to clarify with the physician directly. 19. Which of the following is an example of a patient safety measure in a hospital setting? A. Allowing the patient to administer their own medication without supervision. B. Using bed rails to prevent falls in high-risk patients. C. Ignoring the patient's confusion due to medication. D. Avoiding communication with a healthcare team about changes in the patient's condition. Answer. B. Using bed rails to prevent falls in high-risk patients. Rationale. Using bed rails for patients at high risk for falls is a well-established patient safety measure. Ensuring proper communication and managing confusion are also important, but using bed rails specifically addresses fall risk. 20. In a situation where a nurse must make a clinical judgment quickly, what is the most effective way to prioritize care? A. Address the most comparable and least risky issue first. B. Focus on addressing the life-threatening concerns first. C. Handle all concerns simultaneously. D. Wait for further assessment by the physician. Answer. B. Focus on addressing the life-threatening concerns first. Rationale. In urgent situations, prioritizing life-threatening conditions is critical to patient survival. Non-life-threatening concerns should be addressed after immediate risks are mitigated. Waiting or handling everything at once is not effective. 21. When making clinical judgments, what is the primary role of a nurse in relation to a patient's family? A. To inform the family of the diagnosis directly. B. To ensure the family's preferences override clinical guidelines. C. To provide support and clear communication regarding care. D. To delegate communication to the physician. Answer. C. To provide support and clear communication regarding care. Rationale. The nurse's role includes providing emotional support to the family and ensuring they are informed about the patient's care, while still respecting the patient's confidentiality and preferences. The nurse should not delegate the family communications solely to the physician. 22. Which action is most important when a nurse is conducting an initial assessment of a patient? A. Taking a detailed history of the patient's illness. B. Ensuring the patient's vital signs are recorded. C. Establishing rapport and trust with the patient. D. Administering the required medications. Answer: C. Establishing rapport and trust with the patient. Rationale: establishing rapport and trust is crucial during the initial assessment to ensure that the patient feels comfortable and confident in sharing vital health information. While vital signs and history are also important, trust forms the foundation of effective care. 23. A nurse must decide between several patients requiring attention. Which is the most appropriate first step? A. Attend to the patient who demands attention first. B. Prioritize based on the severity of each patient's condition. C. Speak with a healthcare provider about the situation. D. Begin care with the patient who is most cooperative. Answer: B. Prioritize based on the severity of each patient's condition. Rationale: the nurse should prioritize care based on the severity of the patient's conditions. Critical and life-threatening situations should be addressed first. Cooperation or immediate demands should not override patient need. 24. In a patient with a history of seizures, which action should the nurse take when a seizure occurs? A. Try to restrain the patient to prevent injury. B. Monitor and document the duration and characteristics of the seizure. C. Immediately administer the prescribed sedative medication. D. Leave the patient alone to avoid interference. Answer: B. Monitor and document the duration and characteristics of the seizure. Rationale: during a seizure, the most important actions are to ensure the patient's safety by preventing injury, monitoring the duration and type of seizure, and documenting for clinical assessment. Restraint, sedatives, or leaving the patient are inappropriate and dangerous. 25. What is the first step a nurse should take when a patient exhibits signs of anaphylaxis after receiving medication? A. Administer antihistamines immediately. B. Assess the patient's vital signs and airway. C. Notify the healthcare provider. D. Give the patient fluids to flush out the medication. Answer: B. Assess the patient's vital signs and airway. Rationale: the first priority in anaphylaxis is to assess the patient's airway, breathing, and circulation to ensure they are stable before administering medications or fluids. 26. Which of the following best demonstrates the nurse's use of clinical judgment when caring for a patient with a new diagnosis of diabetes? A. Educating the patient solely on insulin administration. B. Collaborating with the healthcare team to develop a comprehensive care plan. C. Providing the patient with a generic care plan based on their diagnosis. D. Administering insulin based on the patient's blood glucose level. Answer: B. Collaborating with a healthcare team to develop a comprehensive care plan. Rationale: clinical judgment involves using a holistic approach, including collaboration with a healthcare team to develop a comprehensive care plan that addresses all aspects of diabetes management, including lifestyle changes and medication. 27. A nurse is planning care for a patient with a pressure ulcer. What is the most important consideration when developing the care plan? A. Ensuring that the ulcer is cleaned with antiseptic. B. Identifying and addressing the underlying cause of the ulcer. C. Using a wound dressing that is aesthetically pleasing. D. Scheduling daily wound assessments at a consistent time. Answer: B. Identifying and addressing the underlying cause of the ulcer. Rationale: the most important aspect of pressure ulcer care is addressing the underlying cause, such as immobility or malnutrition, to prevent further injury and promote healing. Wound cleaning and dressing are important, but secondary to addressing the cause. 28. When communicating with a patient, which of the following strategies should a nurse use to enhance clinical judgment? A. Use medical jargon to explain complex procedures. B. Encourage the patient to ask questions and express concerns. C. Speak in a condescending tone to ensure understanding. D. Avoid discussing diagnosis-related details to prevent patient anxiety. Answer: B. Encourage the patient to ask questions and express concerns. Rationale: Encouraging the patient to ask questions promotes understanding and helps the nurse gain insights into the patient's concerns, which enhances clinical judgment and the quality of care. Using medical jargon or avoiding discussions can hinder communication. 29. A nurse is caring for a terminally ill patient who has expressed a wish to stop all life-sustaining treatments. The nurse should A. Continue life-sustaining treatments until the family agrees. B. Honor the patient's wishes if they are legally competent. C. Withhold life-sustaining treatments and inform the physician. D. Ignore the patient's wishes and provide comfort measures only. Answer. B. Honor the patient's wishes if they are legally competent. Rationale. If the patient is legally competent, their wishes regarding treatment should be respected. This is a key element in clinical judgment, as it involves both ethical and legal considerations related to patient autonomy. 30. A nurse must decide whether to administer a prescribed medication to a patient with an allergy to that medication. What is the nurse's most appropriate response? A. Administer the medication and monitor for an allergic reaction. B. Contact the healthcare provider to clarify the medication order. C. Administer the medication and document the allergy in the chart. D. Ignore the allergy information and proceed with administration. Answer. B. Contact the healthcare provider to clarify the medication order. Rationale. The nurse should clarify the medication order with the healthcare provider, as administering a medication to which the patient is allergic can cause serious harm. Clarification ensures patient safety and prevents errors. 31. In a situation where a nurse must make a clinical judgment about prioritizing multiple care tasks, what is the most important factor to consider? A. The nurse's personal preferences for care tasks. B. The urgency and severity of each task's impact on patient outcomes. C. The time of day and the nurse's schedule. D. The resources available in the healthcare setting. Answer. B. The urgency and severity of each task's impact on patient outcomes. Rationale. Prioritizing care is based on the urgency and severity of patient needs. Critical tasks that affect patient survival and well-being should always be addressed first. Time of day, personal preferences, and resources are secondary. 32. A nurse is assessing a postoperative patient and notices a drop in oxygen saturation levels. What is the nurse's first action? A. Call for assistance from the healthcare provider. B. Administer oxygen and continue monitoring the patient. C. Perform deep breathing exercises with the patient. D. Document the change and reassess in 30 minutes. Answer. B. Administer oxygen and continue monitoring the patient. Rationale. The first action is to administer oxygen to stabilize the patient's condition and ensure adequate oxygenation. Calling for assistance and documenting can follow, but stabilizing the patient comes first. 33. A patient reports feeling anxious about an upcoming procedure. What is the best approach the nurse can take? A. Ignore the patient's anxiety and proceed with the procedure. B. Offer reassurance without explaining the procedure. C. Provide a detailed explanation of the procedure to reduce anxiety. D. Minimize the patient's concerns by saying, "Don't worry, everything will be fine." Answer. C. Provide a detailed explanation of the procedure to reduce anxiety. Rationale. Providing a detailed explanation of the procedure helps the patient feel more in control and reduces anxiety. Dismissing the concerns or providing vague reassurance may increase the patient's anxiety. 34. What is the most appropriate nursing action when a patient with a history of alcohol abuse presents with confusion and agitation? A. Administer sedatives to calm the patient. B. Immediately assess the patient for signs of alcohol withdrawal. C. Notify the healthcare provider for medication orders. D. Encourage the patient to drink water and rest. Answer. B. Immediately assess the patient for signs of alcohol withdrawal. Rationale. Patients with a history of alcohol abuse are at risk for withdrawal symptoms, which can be life-threatening. Early identification and intervention are crucial to prevent complications. 35. When making a decision about a patient's care plan, what is the nurse's responsibility regarding evidence-based practice? A. Always follow the most recent guidelines without question. B. Review the latest research and adapt care accordingly. C. Rely solely on physician orders for treatment decisions. D. Provide care based on the nurse's personal experience and intuition. Answer. B. Review the latest research and adapt care accordingly. Rationale. Evidence-based practice involves integrating the latest research with clinical expertise to provide the best possible care. Relying on outdated guidelines or intuition without considering evidence can compromise care quality. 36. What is the most important action when a nurse identifies a potential ethical dilemma in patient care? A. Ignore the dilemma and proceed with care as usual. B. Discuss the dilemma with the healthcare team and seek guidance. C. Make a decision based on personal beliefs. D. Act in a way that satisfies the patient's immediate request. Answer. B. Discuss the dilemma with the healthcare team and seek guidance. Rationale. Ethical dilemmas require careful consideration and discussion with the healthcare team to ensure that patient care aligns with ethical standards and best practices. 37. A nurse is caring for a patient in a critical condition. What is the nurse's first priority in clinical decision-making? A. Providing emotional support to the patient's family. B. Monitoring and stabilizing the patient's vital signs. C. Administering prescribed medications. D. Coordinating care with other healthcare providers. Answer. B. Monitoring and stabilizing the patient's vital signs. Rationale. The nurse's first priority in a critical situation is to stabilize the patient's condition by monitoring and addressing vital signs. Emotional support and coordination are important, but secondary to patient stabilization. 38. Which statement best describes the role of a nurse when working with patients from diverse cultural backgrounds? A. Provide care that reflects the nurse's own cultural values. B. Encourage patients to adopt the nurse's cultural practices. C. Offer culturally sensitive care that respects the patient's beliefs. D. Ignore cultural differences to maintain professional boundaries. Answer. C. Offer culturally sensitive care that respects the patient's beliefs. Rationale. The nurse's role is to provide care that respects and accommodates the patient's cultural values, which can impact treatment preferences and outcomes. Ignoring cultural differences may lead to misunderstandings or poor care. 39. When a nurse is assessing pain in a nonverbal patient, what is the most effective approach? A. Use a pain scale to evaluate pain intensity. B. Observe for nonverbal signs of distress, such as facial grimacing. C. Administer pain medication without assessing the patient. D. Ask the family to interpret the patient's pain level. Answer. B. Observe for nonverbal signs of distress, such as facial grimacing. Rationale. In nonverbal patients, the nurse should look for nonverbal cues such as facial expressions, body language, and physiological changes to assess pain. Relying solely on scales or family input may not capture the patient's true experience. 40. What is the primary consideration when determining whether a patient is ready for discharge? A. The patient's ability to manage their medications. B. The patient's understanding of their diagnosis and treatment plan. C. The patient's emotional readiness to leave the hospital. D. The availability of transportation for the patient. Answer. B. The patient's understanding of their diagnosis and treatment plan. Rationale. A key factor in readiness for discharge is ensuring the patient understands their diagnosis and treatment plan to manage their recovery effectively after leaving the hospital. Medication management and emotional readiness are also important, but secondary. 41. What is the primary purpose of a nurse conducting a health assessment on a new patient? A. To develop a diagnosis. B. To determine the patient's financial status. C. To identify potential health risks and create a care plan. D. To review the patient's medical history in detail. Answer. C. To identify potential health risks and create a care plan. Rationale. The health assessment aims to gather information to identify risks and formulate an appropriate care plan for the patient. 42. What is the best approach for a nurse to take when a patient refuses medication? A. Administer the medication forcefully. B. Respect the patient's decision and document the refusal. C. Ignore the refusal and give the medication during the next visit. D. Call security to handle the situation. Answer. B. Respect the patient's decision and document the refusal. Rationale. Nurses must respect the patient's autonomy and right to refuse treatment while documenting the refusal accurately for legal purposes. 43. What is the primary responsibility of a nurse when administering medication to a patient? A. To ensure the patient is aware of the medication's cost. B. To follow the 5 rights of medication administration. C. To convince the patient to take the medication. D. To delegate the task of medication administration to the healthcare assistant. Answer. B. To follow the 5 rights of medication administration. Rationale. The nurse must ensure the correct medication, dosage, time, route, and patient are involved in the administration process to prevent errors. 44. When a nurse is preparing a care plan, which of the following should be considered first? A. The patient's wishes and preferences. B. The nurse's personal opinion about the treatment. C. The doctor's orders and medication list. D. The patient's insurance coverage. Answer. A. The patient's wishes and preferences. Rationale. A patient-centered approach requires considering the patient's preferences and wishes in the development of their care plan. 45. Which of the following is an essential component of cultural competence in nursing practice? A. Providing the same care to all patients regardless of cultural background. B. Recognizing and respecting patients' diverse cultural values and beliefs. C. Encouraging patients to adopt the nurse's cultural norms. D. Ignoring cultural differences to avoid bias. Answer. B. Recognizing and respecting patients' diverse cultural values and beliefs. Rationale. Cultural competence in nursing involves recognizing and respecting the cultural differences of patients to provide individualized care. 46. A patient with a chronic illness reports feeling depressed. What is the nurse's first action? A. Prescribe medication for depression. B. Assess the patient's emotional state and history of mental health. C. Tell the patient that their feelings are a normal part of the illness. D. Refer the patient to a mental health professional immediately. Answer. B. Assess the patient's emotional state and history of mental health. Rationale. The first step is to assess the patient's emotional health to understand the severity of depression and develop an appropriate care plan. 47. A nurse notices a change in a patient's condition. What is the most appropriate next step? A. Wait and observe to see if the condition improves. B. Report the change to the healthcare provider immediately. C. Increase the patient's medication dosage. D. Notify the patient's family without reporting to the doctor. Answer. B. Report the change to the healthcare provider immediately. Rationale. The nurse should report any significant changes in a patient's condition to the healthcare provider promptly to ensure timely intervention. 48. A nurse is preparing a patient for surgery. Which action should be taken to reduce the risk of postoperative infection? A. Administer antibiotics as prescribed before the surgery. B. Provide the patient with pre-surgery dietary restrictions. C. Ensure the patient's consent form is signed. D. Ensure the patient is physically comfortable by adjusting their bed. Answer. A. Administer antibiotics as prescribed before the surgery. Rationale. Administering antibiotics before surgery helps reduce the risk of postoperative infection by preventing bacterial contamination. 49. When a nurse observes signs of distress in a patient, what is the first step? A. Call for immediate medical intervention. B. Begin treatment based on the nurse's judgment. C. Assess the patient's condition and gather more information. D. Document the symptoms and wait for the doctor. Answer. C. Assess the patient's condition and gather more information. Rationale. The first action is to assess the patient's condition thoroughly to determine the appropriate course of action, whether it involves medical intervention or other treatments. 50. A nurse is caring for a terminally ill patient. What is the primary goal of nursing care in this situation? A. To extend the patient's life at all costs. B. To ensure comfort and manage symptoms. C. To provide the patient with experimental treatments. D. To focus only on the physical aspects of care. Answer. B. To ensure comfort and manage symptoms. Rationale. The primary goal in palliative care is to alleviate pain and ensure comfort, improving the quality of life for terminally ill patients. 51. What is the nurse's role in promoting patient safety? A. Ensuring the patient adheres to the prescribed treatment plan. B. Monitoring the patient for any signs of deterioration and taking corrective action. C. Encouraging patients to disregard prescribed safety measures. D. Focusing solely on clinical outcomes and disregarding the patient's environment. Answer. B. Monitoring the patient for any signs of deterioration and taking corrective action. Rationale. The nurse is responsible for monitoring the patient's condition and taking appropriate action to ensure their safety, including addressing any issues that may arise. 52. What should a nurse do when a patient expresses concerns about a proposed treatment? A. Ignore the concerns and proceed with the treatment. B. Acknowledge the concerns and provide more information to the patient. C. Tell the patient their concerns are not valid. D. Refer the patient to another healthcare professional. Answer. B. Acknowledge the concerns and provide more information to the patient. Rationale. The nurse should listen to the patient's concerns and provide additional information to help them make informed decisions about their treatment. 53. When assessing a patient's level of pain, which of the following is most important? A. The patient's verbal description of pain intensity. B. The nurse's observation of the patient's behavior. C. The patient's vital signs. D. The patient's past medical history. Answer. A. The patient's verbal description of pain intensity. Rationale. The most accurate measure of pain is the patient's own description of their pain intensity, which allows the nurse to assess and address it appropriately. 54. What is the most important action to take if a patient falls in a healthcare facility? A. Assist the patient in standing immediately. B. Call for help and do not attempt to move the patient until assistance arrives. C. Document the incident and wait for the physician to assess the situation. D. Reassure the patient and continue with the planned care. Answer. B. Call for help and do not attempt to move the patient until assistance arrives. Rationale. If a patient falls, it is crucial to prevent further injury by not moving the patient until a proper assessment is made by trained personnel. 55. When dealing with a patient who is angry or agitated, what is the most appropriate nursing action? A. Speak calmly and respectfully to de-escalate the situation. B. Avoid eye contact and walk away. C. Argue with the patient to defend the care plan. D. Ignore the patient's emotions and focus on the task at hand. Answer. A. Speak calmly and respectfully to de-escalate the situation. Rationale. Calm and respectful communication can help de-escalate anger or agitation, allowing the nurse to manage the situation effectively and maintain safety. 56. A nurse is caring for a patient with a history of asthma. What should the nurse do if the patient starts wheezing and having difficulty breathing? A. Immediately administer a bronchodilator as prescribed. B. Ask the patient to rest and calm down. C. Encourage the patient to continue activity to relieve symptoms. D. Wait for the physician to assess the patient. Answer. A. Immediately administer a bronchodilator as prescribed. Rationale. In an asthma attack, administering a prescribed bronchodilator is the immediate action to relieve symptoms and ensure the patient's airway remains open. 57. What is the most important consideration when a nurse is creating a care plan for a pediatric patient? A. The preferences of the child's parents. B. The child's understanding and ability to participate in the plan. C. The availability of pediatric-specific equipment. D. The nurse's own preferences based on prior experience. Answer. B. The child's understanding and ability to participate in the plan. Rationale. A pediatric care plan should be age-appropriate, involving the child as much as possible in the process to enhance understanding and cooperation. 58. What is the primary purpose of a nurse conducting a thorough assessment of a patient's health history? A. To establish a therapeutic relationship with the patient. B. To identify potential risks or conditions that may affect treatment. C. To fill out insurance paperwork. D. To understand the patient's preferences in relation to their diet. Answer. B. To identify potential risks or conditions that may affect treatment. Rationale. A comprehensive health history helps identify any conditions or risks that could influence the patient's care plan and treatment options. 59. If a nurse notices a pressure ulcer on a patient's heel, what is the first step in managing the ulcer? A. Apply a dressing and report it to the physician. B. Wash the wound with soap and water immediately. C. Assess the wound for severity and report it to the healthcare provider. D. Leave the wound exposed to air to speed up healing. Answer. C. Assess the wound for severity and report it to the healthcare provider. Rationale. The nurse should assess the wound's severity and then report it to the healthcare provider to determine the appropriate treatment. 60. When educating a patient about a new medication, what should the nurse include? A. The cost of the medication. B. The potential side effects and how to manage them. C. Only the dosage instructions. D. A detailed explanation of the medication's chemical composition. Answer. B. The potential side effects and how to manage them. 61. What is the most important factor in preventing hospital-acquired infections, HAIs? A. Using antiseptic solutions. B. Ensuring proper hand hygiene by healthcare workers. C. Wearing gloves during all patient interactions. D. Providing antibiotics to all patients. Answer. B. Ensuring proper hand hygiene by healthcare workers. Rationale. Proper hand hygiene is the most effective method of preventing the transmission of infections in healthcare settings. 62. Which of the following is an example of a patient-centered communication technique? A. Giving the patient detailed medical jargon. B. Asking open-ended questions and actively listening. C. Speaking in short, direct commands. D. Ignoring the patient's concerns to focus on medical tasks. Answer. B. Asking open-ended questions and actively listening. Rationale. Patient-centered communication emphasizes listening, understanding, and addressing the patient's individual concerns and preferences. 63. A nurse is providing care for a patient with a wound infection. What is the most important action to reduce the risk of further infection? A. Apply an antibiotic ointment to the wound regularly. B. Keep the wound covered with a sterile dressing. C. Change the patient's bed linens frequently. D. Ensure the patient consumes a high-protein diet. Answer. B. Keep the wound covered with a sterile dressing. Rationale. A sterile dressing helps protect the wound from further contamination and infection. 64. What is the primary focus of holistic nursing care? A. Addressing only the patient's physical health needs. B. Focusing solely on the patient's mental health. C. Caring for the patient's overall well-being, including physical, emotional, and spiritual health. D. Prioritizing medical treatments over emotional support. Answer. C. Caring for the patient's overall well-being, including physical, emotional, and spiritual health. Rationale. Holistic nursing focuses on the entire person, considering all aspects of health to promote healing and well-being. 65. A nurse is preparing to administer a blood transfusion. What is the first action the nurse should take? A. Verify the patient's identity and blood type. B. Prepare the blood product for infusion. C. Inform the patient about the procedure. D. Check the patient's vital signs before starting the transfusion. Answer. A. Verify the patient's identity and blood type. Rationale. Patient safety is a priority. Verifying the correct blood type and patient identity reduces the risk of transfusion reactions. 66. When caring for a patient with dementia, which approach is most helpful in managing challenging behavior? A. Using physical restraint to prevent harm. B. Providing clear, simple instructions and maintaining a calm demeanor. C. Ignoring the patient's behavior. D. Confronting the patient about their actions. Answer. B. Providing clear, simple instructions and maintaining a calm demeanor. Rationale. Clear communication and a calm approach can help reduce confusion and anxiety in patients with dementia. 67. A patient with a history of diabetes asks the nurse about managing blood sugar levels. What is the most important topic for the nurse to discuss? A. The importance of a healthy diet and regular exercise. B. How to use a glucose meter. C. The different types of insulin available. D. How to prepare for a hospital stay. Answer. A. The importance of a healthy diet and regular exercise. Rationale. Lifestyle changes such as diet and exercise are crucial in managing diabetes and maintaining healthy blood sugar levels. 68. What is the nurse's role in promoting effective pain management for a patient? A. To provide only medication for pain relief. B. To assess the patient's pain level regularly and offer appropriate interventions. C. To ignore the patient's reports of pain unless it becomes severe. D. To delegate all pain management responsibilities to the physician. Answer. B. To assess the patient's pain level regularly and offer appropriate interventions. Rationale. The nurse should regularly assess pain and intervene with appropriate pain management strategies to enhance comfort. 69. When caring for a patient with a wound, the nurse notices the wound is red, swollen, and has pus. What is the most likely cause of these symptoms? A. An allergic reaction to the dressing. B. A wound infection. C. A healing process complication. D. A new wound forming. Answer. B. A wound infection. Rationale. Redness, swelling, and pus are common signs of infection in a wound. 70. What should a nurse do if a patient refuses to take prescribed medication? A. Force the patient to take the medication. B. Respect the patient's decision and document the refusal. C. Ignore the patient's refusal and administer the medication later. D. Tell the patient they will get worse without the medication. Answer. B. Respect the patient's decision and document the refusal. Rationale. Respecting a patient's right to refuse medication and documenting the refusal is part of patient autonomy and legal compliance. 71. When caring for a patient who is experiencing anxiety, what is the best nursing intervention? A. Encourage the patient to ignore their feelings. B. Stay calm, provide reassurance, and help the patient identify coping mechanisms. C. Limit the patient's access to information about their condition. D. Redirect the patient's thoughts by offering distracting activities. Answer. B. Stay calm, provide reassurance, and help the patient identify coping mechanisms. Rationale. Providing reassurance and helping the patient cope with their anxiety is an essential nursing intervention. 72. A nurse notices a patient's blood pressure has dropped significantly. What is the first action the nurse should take? A. Notify the healthcare provider immediately. B. Reassess the patient's blood pressure in 10 minutes. C. Position the patient in a supine position and elevate the legs. D. Give the patient more fluids and monitor the pressure. Answer. C. Position the patient in a supine position and elevate the legs. Rationale. Positioning the patient correctly can help improve circulation and raise blood pressure temporarily until further action is taken. 73. What is the best way for a nurse to ensure effective communication with a patient who speaks a different language? A. Use family members as interpreters. B. Provide written instructions in the patient's native language. C. Use a professional interpreter service or language line. D. Speak slowly and loudly to the patient. Answer. C. Use a professional interpreter service or language line. Rationale. Professional interpreter services ensure accurate communication between the nurse and patient, reducing misunderstanding. 74. A patient has expressed the desire to discontinue a specific treatment. What is the nurse's responsibility in this situation? A. Convince the patient to continue the treatment. B. Inform the healthcare provider and document the patient's decision. C. Ignore the patient's request and proceed with the treatment. D. Stop the treatment immediately. Answer. B. Inform the healthcare provider and document the patient's decision. Rationale. The nurse must respect the patient's wishes, inform the healthcare provider, and document the decision to ensure continuity of care and compliance with legal standards. 75. When a nurse is caring for a patient receiving chemotherapy, what is the primary concern regarding the patient's safety? A. Ensuring the patient receives adequate hydration. B. Monitoring for signs of infection due to immunosuppression. C. Managing the patient's pain levels. D. Ensuring the patient gets adequate nutrition. Answer: B. Monitoring for signs of infection due to immunosuppression. Rationale: chemotherapy weakens the immune system, making patients more susceptible to infections, so monitoring for signs of infection is crucial. 76. What is the nurse's role when educating a patient with a new diagnosis of hypertension? A. Explain the medical terminology used in the diagnosis. B. Provide information on lifestyle changes, medication adherence, and follow-up care. C. Discourage the patient from seeking additional opinions. D. Focus only on the prescribed medications. Answer: B. Provide information on lifestyle changes, medication adherence, and follow-up care. Rationale: comprehensive education about lifestyle changes, medication adherence, and follow-up care helps patients manage hypertension effectively. 77. A nurse is caring for a patient who is experiencing shortness of breath. What is the first action the nurse should take? A. Administer oxygen as prescribed. B. Place the patient in a semi-Fowler's position. C. Ask the patient to lie flat and rest. D. Call the physician immediately. Answer: B. Place the patient in a semi-Fowler's position. Rationale: the semi-Fowler's position can help relieve shortness of breath by promoting lung expansion. 78. A nurse is caring for a patient with a cast on their leg. What is the best action to prevent complications such as skin breakdown? A. Keep the cast dry and clean. B. Allow the patient to walk on the cast for longer periods. C. Tighten the cast to improve support. D. Use lotions around the edges of the cast to soothe the skin. Answer: A. Keep the cast dry and clean. Rationale: keeping the cast clean and dry is crucial to preventing infection and skin breakdown. 79. What is the nurse's primary responsibility when caring for a patient with a central venous catheter, CVC? A. Administer the prescribed medications and fluids through the catheter. B. Regularly monitor the insertion site for signs of infection or complications. C. Only flush the catheter when it is necessary for medication. D. Ensure that only physicians handle the catheter. Answer: B. Regularly monitor the insertion site for signs of infection or complications. Rationale: regular monitoring for infection or complications is critical in patients with central venous catheters to prevent serious complications. 80. A nurse is educating a patient about smoking cessation. Which of the following is an important point to include in the teaching? A. Nicotine withdrawal will only last for a few hours. B. It is common to gain weight when quitting smoking. C. Quitting smoking will have immediate health benefits. D. Smoking cessation will only improve the patient's lungs, not their overall health. Answer: C. Quitting smoking will have immediate health benefits. Rationale: smoking cessation has immediate health benefits, including improved lung function and decreased risk of cardiovascular disease. 81. What is the best nursing intervention when caring for a patient with a newly placed chest tube? A. Encourage the patient to cough and deep breathe frequently. B. Remove the chest tube as soon as the patient complains of pain. C. Keep the chest tube clamped at all times. D. Encourage the patient to stay in a supine position. Answer: A. Encourage the patient to cough and deep breathe frequently. Rationale: coughing and deep breathing help to expand the lungs and prevent complications such as pneumonia. 82. A nurse is caring for a patient who is receiving an intravenous infusion. What should the nurse do if the site becomes red and swollen? A. Increase the flow rate of the B. Notify the healthcare provider and discontinue the C. Continue the infusion and monitor closely. D. Apply cold compresses to the site. Answer: B. Notify the healthcare provider and discontinue the Rationale: redness and swelling at the site may indicate infiltration or infection, requiring immediate action to prevent complications. 83. When planning care for a patient with a chronic illness, which of the following is the most important factor for the nurse to consider? A. The patient's ability to follow prescribed medication regimens. B. The patient's family history of similar conditions. C. The patient's cultural beliefs and values. D. The patient's social network and support system. Answer: D. The patient's social network and support system. Rationale: a strong social network and support system are crucial for managing chronic illness and improving patient outcomes. 84. A patient is being discharged after a stroke. What should the nurse prioritize when developing a discharge plan? A. Scheduling follow-up appointments with a healthcare provider. B. Instructing the patient to rest for several weeks after discharge. C. Ensuring the patient understands the importance of physical therapy and rehabilitation. D. Teaching the patient how to manage their medications. Answer: C. Ensuring the patient understands the importance of physical therapy and rehabilitation. Rationale: rehabilitation is critical for stroke recovery and improving the patient's functional outcomes after discharge. 85. In what situation would the nurse use an evidence-based approach in patient care? A. When the nurse's experience dictates a specific intervention. B. When the nurse has researched and found the best practices for the patient's condition. C. When the patient prefers a specific treatment. D. When the nurse is following routine protocols without considering patient specifics. Answer: B. When the nurse has researched and found the best practices for the patient's condition. Rationale: evidence-based practice ensures that patient care is grounded in the most current and best available research. 86. Which of the following is a key characteristic of a nurse's role in patient advocacy? A. Making decisions for the patient to avoid confusion. B. Providing all necessary information to the patient to make informed choices. C. Ignoring the patient's wishes if they conflict with the treatment plan. D. Promoting the healthcare system's priorities over the patient's needs. Answer: B. Providing all necessary information to the patient to make informed choices. Rationale: patient advocacy involves supporting the patient's right to make informed decisions about their care. 87. A nurse is caring for a patient who is experiencing an allergic reaction. What should be the first action? A. Administer the prescribed antihistamine. B. Notify the healthcare provider. C. Assess the patient's airway, breathing, and circulation. D. Monitor the patient for any further reactions. Answer: C. Assess the patient's airway, breathing, and circulation. Rationale: ensuring the patient's airway and vital signs are stable is the priority in any allergic reaction to avoid life-threatening complications. 88. In the nursing process, what is the primary purpose of the assessment phase? A. To create a plan of care based on the nurse's intuition. B. To identify and analyze the patient's problems or health status. C. To implement interventions that improve patient health. D. To evaluate the success of the interventions. Answer: B. To identify and analyze the patient's problems or health status. Rationale: assessment is the first step in the nursing process, where data is gathered to identify patient needs and concerns. 89. Which of the following is an example of primary prevention in nursing? A. Administering a flu vaccine to a healthy individual. B. Providing wound care for a patient with a pressure ulcer. C. Offering rehabilitation services after a stroke. D. Providing palliative care for a terminally ill patient. Answer: A. Administering a flu vaccine to a healthy individual. Rationale: primary prevention focuses on preventing disease before it occurs, such as through immunizations. 90. A nurse is preparing to administer a medication that could cause a significant drop in blood pressure. What is the most important action the nurse should take? A. Administer the medication slowly and monitor the blood pressure frequently. B. Provide the medication at a higher dose to speed up its effect. C. Skip the medication and consult the physician immediately. D. Administer the medication and monitor the heart rate only. Answer: A. Administer the medication slowly and monitor the blood pressure frequently. Rationale: slow administration and close monitoring are essential to prevent severe hypotension in response to the medication. 91. A nurse is caring for a patient who has just undergone surgery. What is the first step in assessing the patient's pain level? A. Ask the patient to rate their pain on a scale of 0 to 10. B. Observe the patient's facial expressions and body language. C. Administer the prescribed pain medication. D. Wait for the patient to express discomfort. Answer. A. Ask the patient to rate their pain on a scale of 0 to 10. Rationale. Using a standardized pain scale allows the nurse to assess and document the patient's pain level objectively. 92. What is the most important factor to consider when prioritizing nursing interventions? A. The nurse's personal preferences for certain tasks. B. The severity of the patient's symptoms and the risk to their health. C. The amount of time available to complete the tasks. D. The patient's ability to perform self-care independently. Answer. B. The severity of the patient's symptoms and the risk to their health. Rationale. Prioritization should be based on the severity of the patient's condition and the potential risks involved. 93. What is the best intervention for a patient who is experiencing difficulty breathing and is anxious? A. Place the patient in a supine position to ease breathing. B. Provide reassurance and encourage slow, deep breathing. C. Administer oxygen and avoid any verbal interaction. D. Keep the patient in a sitting position and administer sedatives. Answer. B. Provide reassurance and encourage slow, deep breathing. Rationale. Reassuring the patient and guiding them in slow, deep breathing helps reduce anxiety and facilitates better oxygenation. 94. A nurse is educating a patient with hypertension about lifestyle changes. What is the most important dietary modification to discuss? A. Increase sodium intake to maintain blood pressure. B. Reduce the intake of processed foods and salt. C. Limit fluid intake to reduce swelling. D. Increase the intake of high-fat foods for better energy. Answer. B. Reduce the intake of processed foods and salt. Rationale. Reducing salt and processed foods can help lower blood pressure in hypertensive patients. 95. Which action by the nurse demonstrates effective time management in a busy clinical environment? A. Completing the most complex tasks first to get them out of the way. B. Prioritizing patient care based on urgency and importance. C. Avoiding delegation to others and handling all tasks independently. D. Ignoring non-urgent tasks to focus solely on immediate concerns. Answer. B. Prioritizing patient care based on urgency and importance. Rationale. Effective time management involves prioritizing tasks to ensure that urgent and important patient needs are met first. 96. What is the primary goal of patient-centered care? A. To achieve the best clinical outcomes regardless of the patient's preferences. B. To involve patients in decisions about their health care and respect their preferences. C. To focus on the healthcare team's goals and efficiency. D. To adhere strictly to institutional policies and protocols. Answer. B. To involve patients in decisions about their healthcare and respect their preferences. Rationale. Patient-centered care emphasizes the importance of respecting the patient's values, preferences, and individual needs in the decision-making process. 97. A nurse is caring for a patient with a history of alcohol abuse. What is the most important aspect of the patient's care plan? A. Focus solely on detoxification and discharge. B. Include strategies to help the patient avoid relapse and manage cravings. C. Provide medications to cure alcohol addiction. D. Ignore the patient's alcohol history and focus on their immediate medical needs. Answer. B. Include strategies to help the patient avoid relapse and manage cravings. Rationale. A comprehensive care plan for an alcohol-abusing patient should address both detoxification and long-term strategies to prevent relapse. 98. A nurse is caring for a patient who has undergone a laparotomy. What is the most important intervention to prevent postoperative complications? A. Encourage deep breathing and coughing exercises. B. Keep the patient NPO, nothing by mouth, for 24 hours. C. Administer pain medications to keep the patient comfortable. D. Position the patient in a side-lying position at all times. Answer. A. Encourage deep breathing and coughing exercises. Rationale. Deep breathing and coughing exercises help prevent atelectasis and pneumonia, which are common postoperative complications. 99. What is the primary role of the nurse when providing discharge teaching for a patient with a new diagnosis? A. To provide all the necessary information without considering the patient's readiness to learn. B. To ensure that the patient fully understands the diagnosis and plan of care before leaving the hospital. C. To encourage the patient to leave the hospital quickly to make room for other patients. D. To focus on the patient's emotional reactions to the diagnosis rather than practical information. Answer. B. To ensure that the patient fully understands the diagnosis and plan of care before leaving the hospital. Rationale. Discharge teaching is crucial for patient self-care and adherence to the treatment plan after discharge. 100. What is the best strategy for a nurse to use when providing culturally sensitive care? A. Assume that all patients from the same culture have the same healthcare beliefs and practices. B. Ask open-ended questions to learn about the patient's cultural background and preferences. C. Rely on family members to explain cultural preferences on behalf of the patient. D. Focus on the nurse's cultural background to guide the care process. Answer. B. Ask open-ended questions to learn about the patient's cultural background and preferences. Rationale. Culturally sensitive care involves understanding and respecting each patient's unique cultural beliefs and practices. 101. A patient with a history of asthma asks the nurse about using a nebulizer. What is the nurse's best response? A. You should only use the nebulizer when you are experiencing severe symptoms. B. You should use the nebulizer as prescribed, even if you are not feeling symptoms. C. The nebulizer should be used only if other treatments are ineffective. D. Nebulizers should never be used during an asthma attack. Answer. B. You should use the nebulizer as prescribed, even if you are not feeling symptoms. Rationale. Nebulizers should be used as prescribed to help control asthma symptoms and prevent exacerbations. 102. A nurse is caring for a patient who is recovering from surgery. The patient is showing signs of confusion and agitation. What is the nurse's first priority? A. Provide the patient with sedatives to calm them down. B. Call the healthcare provider to discuss the symptoms. C. Check the patient's oxygen saturation and vital signs. D. Leave the patient alone to rest and recover. Answer. C. Check the patient's oxygen saturation and vital signs. Rationale. Confusion and agitation can be signs of oxygen deprivation or other medical issues, so assessing vital signs is crucial. 103. What is the primary goal of patient education regarding medications? A. To ensure the patient knows how to self-administer the medication. B. To teach the patient about the potential side effects and complications. C. To ensure that the patient can recall the dosage and schedule. D. To help the patient understand the purpose and benefits of the medication. Answer. D. To help the patient understand the purpose and benefits of the medication. Rationale. Understanding the purpose and benefits of medication increases patient adherence and promotes better outcomes. 104. A nurse is caring for a patient who is at risk for falls. What is the most important action to take? A. Place the patient on a soft mattress to prevent injury. B. Use fall precautions, such as keeping the bed in a low position. C. Administer a sedative to ensure the patient stays in bed. D. Monitor the patient only when they are awake and alert. Answer. B. Use fall precautions, such as keeping the bed in a low position. Rationale. Fall precautions are key to preventing injury in high-risk patients, such as adjusting the bed height and keeping the environment clear of obstacles. 105. A nurse is preparing a patient for discharge after a myocardial infarction. What is the most important teaching point? A. Limit physical activity for the first month after discharge. B. Avoid taking any prescribed medications to prevent side effects. C. Follow-up appointments with the healthcare provider are essential. D. Discontinue all medications as soon as you feel better. Answer. C. Follow-up appointments with the healthcare provider are essential. Rationale. Follow-up care is critical after a myocardial infarction to monitor progress and adjust treatment as needed. 106. A nurse is caring for a patient with a wound infection. What should the nurse do first? A. Administer antibiotics as ordered. B. Apply a sterile dressing to the wound. C. Notify the healthcare provider about the infection. D. Assess the wound for signs of infection and report findings. Answer. D. Assess the wound for signs of infection and report findings. Rationale. Proper assessment helps determine the severity of the infection and informs appropriate interventions. 107. A nurse is caring for a patient with severe dehydration. What is the most important priority for the nurse? A. Administer intravenous fluids as prescribed. B. Provide oral hydration with electrolyte solutions. C. Ensure the patient is in a comfortable position. D. Give the patient high-calorie foods immediately. Answer. A. Administer intravenous fluids as prescribed. Rationale. Intravenous fluids are the quickest and most effective way to treat severe dehydration. 108. What is the primary reason for a nurse to use therapeutic communication techniques when caring for patients? A. To gather information needed for the care plan. B. To establish a trusting relationship and promote patient comfort. C. To educate the patient about the treatment plan. D. To clarify medical terminology for the patient. Answer. B. To establish a trusting relationship and promote patient comfort. Rationale. Therapeutic communication builds trust, which is essential for effective patient care and promoting positive health outcomes. 109. Which of the following is an example of a nurse demonstrating cultural competence? A. Assuming that all patients from the same culture share similar beliefs. B. Asking patients about their cultural preferences regarding healthcare. C. Ignoring cultural differences to provide the same care to everyone. D. Providing care based solely on your own cultural values. Answer. B. Asking patients about their cultural preferences regarding healthcare. Rationale. Cultural competence involves understanding and respecting each patient's unique cultural needs and preferences. 110. When assessing a patient's pain, which of the following is the most important to evaluate? A. The patient's vital signs. B. The patient's self-reported pain level. C. The patient's history of pain medication use. D. The patient's family history of pain disorders. Answer. B. The patient's self-reported pain level. Rationale. Pain is a subjective experience, and the patient's self-reported pain level is the most accurate indicator of their discomfort. 111. A nurse is caring for a patient with a wound that is healing slowly. What is the most important factor to assess? A. The patient's nutritional status. B. The patient's pain level. C. The patient's emotional state. D. The patient's ability to perform activities of daily living. Answer. A. The patient's nutritional status. Rationale. Proper nutrition is essential for wound healing, as it provides the necessary nutrients to support tissue repair. 112. What is the most important aspect of maintaining a safe environment for patients in a healthcare facility? A. Regular cleaning and disinfecting of surfaces. B. Ensuring that all staff members are properly trained in safety protocols. C. Keeping the patient's room temperature comfortable. D. Making sure the patient has access to entertainment and distractions. Answer. B. Ensuring that all staff members are properly trained in safety protocols. Rationale. Training staff in safety protocols helps prevent accidents and ensures that all safety measures are consistently followed. 113. Which action is most important when caring for a patient with a chest tube? A. Keeping the chest tube clamp in place at all times. B. Ensuring that the chest tube is properly secured and functioning. C. Administering pain medications frequently. D. Restricting the patient's movement to avoid dislodging the tube. Answer. B. Ensuring that the chest tube is properly secured and functioning. Rationale. The chest tube must be monitored to ensure it is properly draining and that there are no leaks or complications. 114. What is the most important nursing action when caring for a patient with a urinary catheter? A. Ensuring the catheter is securely fastened to prevent dislodgement. B. Changing the catheter every 24 hours to prevent infection. C. Ensuring that the catheter bag is kept below the level of the bladder. D. Restricting fluid intake to prevent overhydration. Answer. C. ensuring that the catheter bag is kept below the level of the bladder. Rationale: keeping the catheter bag below the bladder helps prevent backflow of urine, which can lead to infection. 115. What is the primary goal when providing care for a patient with a chronic illness? A. To cure the illness completely. B. To manage symptoms and improve quality of life. C. To provide comfort and avoid any further complications. D. To encourage the patient to stop treatment as soon as they feel better. Answer: B. To manage symptoms and improve quality of life. Rationale: chronic illness management focuses on symptom control, preventing complications, and enhancing quality of life. 116. A nurse is preparing to administer an intramuscular injection. Which action is most important to ensure patient safety? A. Select the appropriate site for injection based on patient factors. B. Cleanse the site with alcohol and allow it to dry before injection. C. Use a needle that is the shortest available for the injection. D. Avoid any conversation with the patient during the procedure. Answer: A. Select the appropriate site for injection based on patient factors. Rationale: selecting the correct injection site based on the patient's anatomy and condition ensures safe and effective delivery of medication. 117. Which of the following is an important aspect of a nurse's role when providing end-of-life care? A. Focus only on pain management and avoid discussing the patient's emotional needs. B. Support the patient's and family's emotional, spiritual, and physical needs. C. Encourage the patient to stop discussing their concerns. D. Continue all treatments to prolong life, regardless of the patient's wishes. Answer: B. Support the patient's and family's emotional, spiritual, and physical needs. Rationale: end-of-life care addresses all aspects of the patient's well-being, including emotional and spiritual needs. 118. Which intervention is most important when caring for a patient with a surgical wound? A. Applying heat to the wound to promote healing. B. Ensuring the wound is kept clean and dry. C. Limiting the patient's movement to prevent strain on the wound. D. Changing the dressing as frequently as possible. Answer: B. Ensuring the wound is kept clean and dry. Rationale: proper wound care, including cleanliness and dryness, reduces the risk of infection and promotes healing. 119. What is the primary consideration when caring for a patient with a history of anxiety? A. Provide clear and direct instructions without any room for interpretation. B. Encourage the patient to face their fears directly without support. C. Offer reassurance and a calm environment to reduce anxiety. D. Limit communication to avoid overwhelming the patient. Answer: C. Offer reassurance and a calm environment to reduce anxiety. Rationale: a calm and reassuring approach helps patients manage anxiety and feel safe in their care environment. 120. What is the first priority when caring for a patient who has suffered a stroke? A. Administer thrombolytic therapy as soon as possible. B. Obtain a complete history of the patient's symptoms. C. Monitor the patient's vital signs closely. D. Begin rehabilitation exercises immediately. Answer: A. Administer thrombolytic therapy as soon as possible. Rationale: thrombolytic therapy is most effective when administered early in the stroke to break up the clot and reduce brain damage. 121. A nurse is caring for a patient with a severe allergic reaction. What is the first priority? A. Administer antihistamines. B. Apply a cold compress to the affected area. C. Administer epinephrine as ordered. D. Assess the patient's vital signs. Answer: C. Administer epinephrine as ordered. Rationale: epinephrine is the first-line treatment for severe allergic reactions, as it can rapidly reverse symptoms like airway constriction. 122. A nurse is educating a patient with hypertension on lifestyle changes. Which of the following should be prioritized? A. Reducing sodium intake. B. Increasing caffeine consumption. C. Reducing daily physical activity. D. Avoiding medications. Answer: A. Reducing sodium intake. Rationale: reducing sodium intake helps lower blood pressure and is a key component of managing hypertension. 123. Which of the following is an important consideration when caring for a patient with diabetes? A. Encouraging the patient to eat high-sugar snacks for energy. B. Monitoring blood sugar levels regularly and adjusting insulin as needed. C. Restricting all carbohydrate intake. D. Encouraging the patient to avoid all forms of physical activity. Answer. B. Monitoring blood sugar levels regularly and adjusting insulin as needed. Rationale. Regular monitoring of blood sugar is essential for managing diabetes and preventing complications. 124. A nurse is caring for a patient who is experiencing a seizure. What should the nurse do first? A. Insert a bite block into the patient's mouth. B. Hold the patient down to prevent injury. C. Place the patient on their side and protect their head. D. Administer anticonvulsant medication immediately. Answer. C. Place the patient on their side and protect their head. Rationale. Placing the patient on their side helps prevent aspiration, and protecting their head reduces the risk of injury during a seizure. 125. What is the most important nursing intervention when caring for a patient with a chest wound? A. Cover the wound with a sterile dressing and tape it securely. B. Administer pain medications as prescribed. C. Apply an airtight dressing to prevent air from entering the wound. D. Encourage the patient to breathe deeply to promote lung expansion. Answer. C. Apply an airtight dressing to prevent air from entering the wound. Rationale. An airtight dressing helps prevent air from entering the chest cavity, which can cause a tension pneumothorax. 126. A nurse is preparing to administer a blood transfusion to a patient. What is the most important action to take? A. Administer the blood at the fastest rate possible. B. Verify the patient's identity and blood type with another nurse. C. Premedicate the patient with antihistamines. D. Warm the blood before administration. Answer. B. Verify the patient's identity and blood type with another nurse. Rationale. Verifying the patient's identity and blood type reduces the risk of administering the wrong blood type, which could be fatal. 127. A nurse is caring for a patient with a urinary tract infection, UTI. What is the most important nursing action? A. Encourage fluid intake to flush out the infection. B. Restrict the patient's fluid intake to reduce urinary frequency. C. Use a sterile catheter to collect urine samples. D. Administer antibiotics as ordered and monitor for side effects. Answer. A. Encourage fluid intake to flush out the infection. Rationale. Increased fluid intake helps flush out bacteria from the urinary tract, which can aid in the recovery from a UTI. 128. When administering medications to a pediatric patient, what is the most important consideration? A. Giving the medication as fast as possible to reduce discomfort. B. Using a medication dosage appropriate for the child's age and weight. C. Always using liquid forms of medication, regardless of the child's age. D. Giving the child a reward after taking the medication. Answer. B. Using a medication dosage appropriate for the child's age and weight. Rationale. Pediatric dosing is based on weight and age to ensure safe and effective medication administration. 129. Which of the following is the most important step in preventing the spread of infection in a healthcare setting? A. Performing hand hygiene regularly. B. Wearing gloves at all times. C. Administering antibiotics to all patients. D. Ensuring all surfaces are cleaned with disinfectant. Answer. A. Performing hand hygiene regularly. Rationale. Hand hygiene is the most effective measure to prevent the spread of infections in healthcare settings. 130. A nurse is caring for a patient with a terminal illness. Which approach is most appropriate when discussing the patient's condition? A. Encourage the patient to remain hopeful and focus only on the positive. B. Avoid discussing the patient's condition to prevent distress. C. Be honest about the prognosis while providing emotional support. D. Focus only on pain management and avoid emotional conversations. Answer. C. Be honest about the prognosis while providing emotional support. Rationale. Honest communication about prognosis, coupled with emotional support, helps the patient make informed decisions and cope with their illness. 131. What is the priority nursing action when caring for a patient with an open fracture? A. Clean and irrigate the wound. B. Immobilize the affected limb. C. Administer pain medication as prescribed. D. Assess for signs of infection. Answer. B. Immobilize the affected limb. Rationale. Immobilizing the limb helps prevent further injury and complications, such as vascular or nerve damage. 132. A nurse is educating a patient about the use of an inhaler. What is the most important teaching point? A. Inhale quickly and forcefully when using the inhaler. B. Rinse the mouth after each use to prevent thrush. C. Only use the inhaler when you experience symptoms. D. Keep the inhaler in a warm, humid place for easy access. Answer. B. Rinse the mouth after each use to prevent thrush. Rationale. Rinsing the mouth after using an inhaler reduces the risk of fungal infections, such as thrush. 133. A nurse is caring for a patient who is receiving chemotherapy. What is the most important action to monitor for during treatment? A. Changes in vital signs. B. The patient's emotional state. C. The onset of nausea and vomiting. D. The appearance of hair loss. Answer. C. The onset of nausea and vomiting. Rationale. Chemotherapy often causes nausea and vomiting, which can lead to dehydration and electrolyte imbalances. 134. Which of the following should a nurse do when assessing a patient for pain? A. Rely solely on the patient's vital signs. B. Use a pain assessment tool, such as the numeric rating scale. C. Avoid discussing pain with the patient to prevent distress. D. Always administer pain medications immediately, without assessment. Answer. B. Use a pain assessment tool, such as the numeric rating scale. Rationale. A standardized pain assessment tool helps accurately evaluate the patient's pain and guide treatment decisions. 135. What is the best nursing action when caring for a patient experiencing dyspnea? A. Place the patient in a supine position to promote lung expansion. B. Administer oxygen as prescribed. C. Restrict fluid intake to reduce respiratory distress. D. Encourage the patient to take shallow breaths to avoid discomfort. Answer. B. Administer oxygen as prescribed. Rationale. Oxygen administration improves oxygenation and helps alleviate the discomfort associated with dyspnea. 136. A nurse is caring for a patient who has just received a pacemaker. What is an important instruction for the patient post-procedure? A. Avoid lifting heavy objects for at least 2 weeks. B. Return to normal activity immediately after discharge. C. Sleep on the side of the implanted pacemaker. D. Limit fluid intake for 24 hours following the procedure. Answer. A. Avoid lifting heavy objects for at least 2 weeks. Rationale. After pacemaker implantation, avoiding heavy lifting prevents strain on the pacemaker and the insertion site. 137. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD. Which action should be prioritized? A. Administering high-flow oxygen therapy to ensure adequate oxygenation. B. Encouraging the patient to participate in deep breathing exercises. C. Encouraging fluid intake to thin respiratory secretions. D. Limiting physical activity to prevent exacerbation of symptoms. Answer. B. Encouraging the patient to participate in deep breathing exercises. Rationale. Deep breathing exercises help improve lung function and reduce the work of breathing in patients with COPD. 138. What is the priority nursing action for a patient experiencing anaphylaxis? A. Administer antihistamines as prescribed. B. Apply a cold compress to the affected area. C. Administer epinephrine immediately. D. Place the patient in a semi-Fowler's position. Answer. C. Administer epinephrine immediately. Rationale. Epinephrine is the first-line treatment for anaphylaxis to rapidly reverse airway constriction and other severe symptoms. 139. A nurse is providing education to a patient with congestive heart failure. What is the most important information to include? A. Limit sodium intake and monitor fluid balance. B. Avoid any physical activity to reduce strain on the heart. C. Take prescribed diuretics only when feeling short of breath. D. Use a low-fat diet to prevent weight gain. Answer: A. Limit sodium intake and monitor fluid balance. Rationale: sodium restriction and fluid balance management are key components of managing congestive heart failure. 140. What is the priority nursing intervention for a patient with a wound infection? A. Administer pain medication. B. Apply a warm compress to the wound. C. Notify the healthcare provider about the infection. D. Assess the wound for drainage and other signs of infection. Answer: D. Assess the wound for drainage and other signs of infection. Rationale: proper assessment of the wound helps guide further treatment and interventions to address the infection. 141. A nurse is caring for a patient who is post-operative after a hip replacement. What is the most important priority for this patient? A. Encourage early ambulation. B. Monitor the patient's intake and output. C. Apply ice packs to reduce swelling. D. Administer pain medications as prescribed. Answer: A. Encourage early ambulation. Rationale: early ambulation helps prevent complications such as deep vein thrombosis, DVT, and promotes healing and recovery. 142. A nurse is assessing a patient's pain using a numeric rating scale, 0 to 10. The patient rates their pain as 8. What should the nurse do next? A. Administer pain medication as prescribed. B. Reassure the patient that pain is normal. C. Encourage the patient to relax and breathe deeply. D. Document the pain rating and continue to monitor. Answer: A. Administer pain medication as prescribed. Rationale: when a patient rates pain as 8, it is important to address the pain promptly with appropriate medication as prescribed. 143. A nurse is caring for a patient with a history of alcohol use disorder. Which of the following is the priority assessment for this patient? A. Blood alcohol level. B. Nutritional status. C. Liver function tests. D. Withdrawal symptoms. Answer: D. Withdrawal symptoms. Rationale: withdrawal symptoms can be life-threatening and should be prioritized for early intervention and management. 144. A nurse is caring for a patient with chronic kidney disease. Which of the following interventions is most important? A. Limit potassium intake. B. Encourage high-protein diet. C. Encourage fluid intake. D. Restrict sodium intake. Answer: A. Limit potassium intake. Rationale: in chronic kidney disease, impaired kidney function leads to the accumulation of potassium, which can cause life-threatening hyperkalemia. 145. A nurse is preparing to administer an intramuscular injection. Which site should the nurse choose? A. Dorsogluteal site. B. Ventrogluteal site. C. Deltoid muscle. D. Vastus lateralis. Answer: B. Ventrogluteal site. Rationale: the ventrogluteal site is the preferred site for intramuscular injections because it has the least risk for injury to blood vessels and nerves. 146. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD. Which of the following should be prioritized in the patient's care plan? A. Administer high-flow oxygen therapy to improve oxygenation. B. Encourage smoking cessation to prevent further lung damage. C. Recommend complete bed rest to reduce fatigue. D. Encourage deep breathing exercises and pursed lip breathing. Answer: D. Encourage deep breathing exercises and pursed lip breathing. Rationale: deep breathing exercises and pursed lip breathing help improve airflow and decrease shortness of breath in COPD patients. 147. A nurse is caring for a patient who is undergoing chemotherapy. The patient complains of severe nausea. Which intervention is most appropriate? A. Administer antiemetic medication as prescribed. B. Encourage the patient to take fluids frequently. C. Restrict the patient's food intake to prevent vomiting. D. Allow the patient to eat high-fat, greasy foods. Answer: A. Administer antiemetic medication as prescribed. Rationale: Antiemetic medications are prescribed to manage chemotherapy-induced nausea and vomiting and should be administered promptly. 148. A nurse is caring for a patient who is being discharged after a myocardial infarction. Which instruction is most important for the patient to follow? A. Limit physical activity for several weeks. B. Take prescribed medications as ordered. C. Avoid any stressful situations. D. Return to normal activities immediately to prevent further heart strain. Answer. B. Take prescribed medications as ordered. Rationale. Adherence to prescribed medications is essential in preventing complications and managing the patient's condition after a myocardial infarction. 149. A nurse is educating a patient with type 2 diabetes on dietary changes. Which food choice is most appropriate? A. White bread. B. Roasted vegetables. C. Fruit juices. D. Sweetened cereals. Answer. B. Roasted vegetables. Rationale. Roasted vegetables are low in sugar and carbohydrates, making them an appropriate food choice for managing type 2 diabetes. 150. A nurse is assessing a postoperative patient for signs of deep vein thrombosis, DVT. Which of the following is a key sign to monitor for? A. Hematuria. B. Calf pain and swelling. C. Excessive bleeding from the surgical site. D. Low-grade fever. Answer. B. Calf pain and swelling. Rationale. Calf pain and swelling are common signs of DVT, and prompt identification is crucial to prevent further complications. 151. A nurse is caring for a patient with a history of heart failure. Which of the following signs or symptoms should the nurse prioritize? A. Increased appetite. B. Decreased urinary output. C. Increased thirst. D. Swelling of the ankles. Answer. B. Decreased urinary output. Rationale. Decreased urinary output in a heart failure patient can indicate fluid retention and worsening of heart failure. 152. A nurse is caring for a patient with a hip fracture. Which intervention is most important to prevent complications? A. Encourage the patient to perform leg exercises. B. Apply a traction device to the leg. C. Administer pain medications as prescribed. D. Monitor for signs of infection at the surgical site. Answer. A. Encourage the patient to perform leg exercises. Rationale. Leg exercises help improve circulation, prevent DVT, and promote healing following a hip fracture. 153. A nurse is caring for a patient receiving a blood transfusion. Which action should the nurse take if the patient begins to exhibit signs of an allergic reaction? A. Stop the transfusion and notify the healthcare provider. B. Increase the rate of the transfusion. C. Apply warm compresses to the site of the transfusion. D. Continue the transfusion but monitor closely. Answer. A. Stop the transfusion and notify the healthcare provider. Rationale. An allergic reaction to a blood transfusion requires immediate cessation of the transfusion and prompt medical intervention. 154. A nurse is educating a patient with asthma on how to use a metered dose inhaler. Which instruction is most important? A. Shake the inhaler before each use. B. Inhale quickly and deeply when using the inhaler. C. Use the inhaler only during an asthma attack. D. Hold your breath for 1 second after inhalation. Answer. A. Shake the inhaler before each use. Rationale. Shaking the inhaler ensures that the medication is properly mixed and ready for delivery to the lungs. 155. A nurse is preparing a patient for discharge after a stroke. What should be prioritized in discharge planning? A. Arranging for follow-up care and rehabilitation. B. Providing information on stroke prevention only. C. Focusing on teaching the patient to perform activities of daily living independently. D. Encouraging the patient to return to normal activity immediately. Answer. A. Arranging for follow-up care and rehabilitation. Rationale. Stroke patients need follow-up care and rehabilitation to maximize recovery and reduce the risk of further complications. 156. A nurse is caring for a patient who has just undergone a lumbar puncture. What is the most important nursing action following the procedure? A. Encourage the patient to lie flat to prevent a headache. B. Administer pain medications to manage discomfort. C. Monitor the patient for signs of a reaction to the contrast dye. D. Allow the patient to sit up immediately to promote circulation. Answer. A. Encourage the patient to lie flat to prevent a headache. Rationale. Lying flat helps prevent post-lumbar puncture headaches caused by cerebrospinal fluid leakage. 157. A nurse is caring for a patient receiving an opioid for pain management. What is the most important nursing action to monitor for? A. Nausea and vomiting. B. Respiratory depression. C. Constipation. D. Allergic reactions. Answer. B. Respiratory depression. Rationale. Opioid medications can cause respiratory depression, which is the most dangerous side effect and requires close monitoring. 158. A nurse is caring for a patient who is at risk for aspiration. Which of the following is the best position to prevent aspiration during feeding? A. Semi-Fowler's position. B. Trendelenburg position. C. Prone position. D. High Fowler's position. Answer. D. High Fowler's position. Rationale. The high Fowler's position, sitting upright, reduces the risk of aspiration during feeding by promoting proper swallowing. 159. A nurse is assessing a patient with a stroke. What is the most important assessment to perform immediately? A. Check the patient's blood pressure. B. Assess the patient's level of consciousness. C. Measure oxygen saturation levels. D. Perform a neurologic assessment using the Glasgow Coma Scale. Answer. B. Assess the patient's level of consciousness. Rationale. Assessing the level of consciousness is crucial for identifying the severity of the stroke and determining the appropriate intervention. 160. A nurse is preparing a patient for a colonoscopy. Which statement by the patient indicates a need for further teaching? A. I will need to fast for 24 hours before the procedure. B. I can take my usual medications with water before the procedure. C. I will need to drink a bowel cleansing solution before the procedure. D. I will need to arrange for transportation after the procedure. Answer. A. I will need to fast for 24 hours before the procedure. Rationale. Patients usually fast for 12 to 24 hours before a colonoscopy, but fasting for 24 hours is excessive and may need clarification based on specific instructions from the healthcare provider. 161. A nurse is caring for a patient with a chest tube after a pneumothorax. Which of the following should the nurse prioritize when monitoring the chest tube system? A. Checking for air bubbles in the water seal chamber. B. Ensuring the chest tube is clamped when not in use. C. Keeping the chest tube drainage system above the level of the chest. D. Ensuring that the chest tube is securely taped at the insertion site. Answer. A. Checking for air bubbles in the water seal chamber. Rationale. Air bubbles in the water seal chamber indicate a potential air leak in the system, which needs to be addressed promptly to prevent complications. 162. A nurse is caring for a patient who is receiving a blood transfusion. Which action is most important to take during the first 15 minutes of the transfusion? A. Monitor vital signs and observe for reactions. B. Administer pain medications if the patient complains of discomfort. C. Allow the patient to drink fluids freely. D. Restrict the patient's activity during the transfusion. Answer. A. Monitor vital signs and observe for reactions. Rationale. The first 15 minutes of a blood transfusion are critical for identifying potential allergic or transfusion reactions, so monitoring vital signs is essential. 163. A nurse is assessing a patient for possible sepsis. Which of the following signs and symptoms should the nurse prioritize for immediate intervention? A. Decreased blood pressure and increased heart rate. B. Warm, flushed skin and normal temperature. C. Dry mouth and decreased urinary output. D. Decreased respiratory rate and clear lung sounds. Answer. A. Decreased blood pressure and increased heart rate. Rationale. Decreased blood pressure and increased heart rate are key signs of sepsis, indicating a need for immediate intervention to prevent shock. 164. A nurse is caring for a patient with a history of hypertension. Which blood pressure reading would indicate the need for further assessment and intervention? A. 130/85 mmHg. B. 140/90 mmHg. C. 160/100 mmHg. D. 120/75 mmHg. Answer: C. 160/100 mmHg. Rationale: a blood pressure of 160/100 mmHg is considered hypertensive and requires further assessment and possible intervention to prevent complications. 165. A nurse is caring for a postoperative patient who is complaining of nausea and vomiting. Which intervention should the nurse implement first? A. Administer an antiemetic as prescribed. B. Encourage the patient to drink fluids. C. Increase the frequency of ambulation. D. Perform an assessment of bowel sounds. Answer: A. Administer an antiemetic as prescribed. Rationale: administering an antiemetic will address the patient's symptoms of nausea and vomiting and provide relief. 166. A nurse is caring for a patient with a history of diabetes mellitus who is experiencing hypoglycemia. Which of the following interventions should be prioritized? A. Administer a 15g carbohydrate snack. B. Administer insulin to lower the blood glucose level. C. Encourage the patient to rest and drink fluids. D. Monitor the patient's blood glucose every 30 minutes. Answer: A. Administer a 15g carbohydrate snack. Rationale: in hypoglycemia, providing a quick source of glucose, 15g carbohydrate snack, is essential for raising the patient's blood sugar level to normal levels. 167. A nurse is caring for a patient who has a history of falls. Which intervention is most effective in preventing future falls? A. Ensure that the call light is within reach at all times. B. Use a gait belt when assisting the patient to ambulate. C. Encourage the patient to wear non-slip socks while in bed. D. Keep the room lights dimmed to prevent confusion at night. Answer: B. Use a gait belt when assisting the patient to ambulate. Rationale: using a gait belt ensures safe ambulation by providing support and reducing the risk of falls when the patient is moving. 168. A nurse is caring for a patient with a severe allergic reaction to a bee sting. Which of the following interventions should the nurse perform first? A. Administer epinephrine as prescribed. B. Apply a cold compress to the affected area. C. Assess the patient's airway and respiratory status. D. Monitor vital signs every 15 minutes. Answer: C. Assess the patient's airway and respiratory status. Rationale: the most urgent concern in an allergic reaction is airway compromise, and the nurse must assess the airway first to ensure proper oxygenation. 169. A nurse is caring for a patient who has just received a dose of digoxin. Which of the following findings would indicate that the nurse should withhold the medication? A. A pulse rate of 58 beats per minute. B. A blood pressure of 120/78 mmHg. C. Serum potassium level of 3.0 milliequivalent/L. D. Serum creatinine level of 1.2 milligrams per deciliter. Answer: A. A pulse rate of 58 beats per minute. Rationale: digoxin slows the heart rate, and a pulse rate below 60 beats per minute is a sign that the medication should be withheld due to the risk of bradycardia. 170. A nurse is caring for a patient who is receiving intravenous for fluids. The nurse notices that the foresight is swollen and cool to the touch. What is the first action the nurse should take? A. Remove the forecatheter and apply a warm compress. B. Increase the flow rate of the fluids. C. Document the findings and continue to monitor. D. Notify the healthcare provider immediately. Answer: A. Remove the forecatheter and apply a warm compress. Rationale: the swelling and coolness at the foresite indicate possible infiltration, and the first step is to remove the forecatheter and apply a warm compress to reduce discomfort and swelling. 171. A nurse is caring for a patient who is at risk for developing pressure ulcers. Which of the following is the most important intervention to prevent pressure ulcers? A. Turn the patient every 2 hours. B. Massage bony prominences to improve circulation. C. Provide a high-protein diet to promote healing. D. Keep the patient's skin clean and dry. Answer: A. Turn the patient every 2 hours. Rationale: repositioning the patient every 2 hours helps reduce pressure on bony prominences and is a primary method for preventing pressure ulcers. 172. A nurse is caring for a patient with end-stage renal disease, ESRD. Which of the following interventions is most important to prevent complications? A. Encourage high-protein intake. B. Monitor electrolyte levels, particularly potassium. C. Limit fluid intake to 2 liters per day. D. Increase sodium intake to prevent dehydration. Answer: B. Monitor electrolyte levels, particularly potassium. Rationale: in ESRD, the kidneys cannot adequately excrete potassium, which can lead to dangerous hyperkalemia. Monitoring potassium levels is crucial. 173. A nurse is caring for a patient with acute pancreatitis. Which of the following interventions is most important in the management of this condition? A. Encourage oral fluid intake. B. Administer analgesics for pain relief. C. Encourage a high-fat diet for nutrition. D. Monitor blood glucose levels closely. Answer: B. Administer analgesics for pain relief. Rationale: pain management is the priority in acute pancreatitis as it is often associated with severe pain, and adequate pain relief is essential for patient comfort and recovery. 174. A nurse is educating a patient with chronic obstructive pulmonary disease, COPD, about medication use. Which statement by the patient indicates the need for further teaching? A. I should use my inhaler before exercising to prevent shortness of breath. B. I should wait 30 seconds between inhalations if using 2 inhalers. C. I can stop using my inhaler once my symptoms improve. D. I should rinse my mouth after using my inhaler to prevent oral infections. Answer: C. I can stop using my inhaler once my symptoms improve. Rationale: COPD is a chronic condition, and the patient should continue to use the prescribed medications as directed, even if symptoms improve, to manage the disease effectively. 175. A nurse is caring for a patient who is receiving a transfusion of packed red blood cells. The nurse notices that the patient has developed a fever and chills. What is the first action the nurse should take? A. Stop the transfusion immediately and notify the healthcare provider. B. Continue the transfusion and monitor the patient closely. C. Administer an antipyretic medication as prescribed. D. Increase the rate of the transfusion to counteract the symptoms. Answer: A. Stop the transfusion immediately and notify the healthcare provider. Rationale: a fever and chills during a blood transfusion are signs of a potential transfusion reaction, and stopping the transfusion is the first action to prevent further complications. 176. A nurse is caring for a patient with a diagnosis of acute renal failure. Which intervention should the nurse prioritize? A. Administering a diuretic to promote fluid loss. B. Monitoring serum creatinine and BUN levels. C. Encouraging the patient to drink increased fluids. D. Restricting potassium intake to prevent hyperkalemia. Answer: B. Monitoring serum creatinine and BUN levels. Rationale: monitoring renal function markers like creatinine and BUN is critical in managing acute renal failure and guiding treatment decisions. 177. A nurse is caring for a patient who is receiving oxygen therapy via nasal cannula. The nurse notes that the patient's oxygen saturation is 88%. Which of the following actions should the nurse take first? A. Increase the oxygen flow rate. B. Reposition the nasal cannula. C. Notify the healthcare provider. D. Assess the patient's respiratory status. Answer: D. Assess the patient's respiratory status. Rationale: the first action is to assess the patient's respiratory status to determine the cause of the low oxygen saturation and take appropriate action. 178. A nurse is caring for a patient with a surgical wound that has signs of infection, including redness, warmth, and purulent drainage. Which of the following interventions is most important? A. Monitor the wound for any changes in size. B. Cleanse the wound with sterile saline and apply a new dressing. C. Administer a tetanus booster as prescribed. D. Perform a complete blood count, CBC, to assess for systemic infection. Answer. B. Cleanse the wound with sterile saline and apply a new dressing. Rationale. The most important intervention is to cleanse the wound to prevent further infection and apply a clean dressing to promote healing. 179. A nurse is caring for a patient who is receiving chemotherapy and has developed neutropenia. Which action should the nurse prioritize? A. Monitor the patient's temperature every 4 hours. B. Administer prescribed colony-stimulating factor, CSF. C. Encourage the patient to maintain a high-protein diet. D. Restrict visitors to prevent infections. Answer. A. Monitor the patient's temperature every 4 hours. Rationale. Neutropenic patients are at high risk for infection, so frequent temperature monitoring is crucial for identifying early signs of infection. 180. A nurse is assessing a patient who has just been prescribed a new antihypertensive medication. Which of the following should the nurse include in the teaching plan? A. Monitor your blood pressure regularly while taking this medication. B. This medication should only be taken in the morning. C. This medication can be stopped immediately if side effects occur. D. It is important to take this medication with food to prevent nausea. Answer. A. Monitor your blood pressure regularly while taking this medication. Rationale. Monitoring blood pressure regularly is essential to assess the effectiveness of antihypertensive medication and adjust the dose as needed. 181. A nurse is caring for a patient who is at risk for deep vein thrombosis, DVT. Which intervention should the nurse prioritize? A. Encourage the patient to walk frequently. B. Massage the patient's legs to promote circulation. C. Place a heating pad on the patient's legs to relieve discomfort. D. Ensure that the patient remains in bed as much as possible. Answer. A. Encourage the patient to walk frequently. Rationale. Encouraging ambulation helps prevent the formation of DVT by promoting circulation and reducing the risk of blood clots. 182. A nurse is caring for a patient who has just received a dose of 4-morphine for pain management. Which of the following is the nurse's priority action? A. Monitor the patient's oxygen saturation and respiratory rate. B. Encourage the patient to cough and deep breathe. C. Increase the patient's fluid intake to prevent constipation. D. Document the patient's pain level every 4 hours. Answer. A. Monitor the patient's oxygen saturation and respiratory rate. Rationale. Morphine can cause respiratory depression, and the nurse must prioritize monitoring the patient's oxygen saturation and respiratory rate for early signs of respiratory compromise. 183. A nurse is caring for a patient who has just had a hysterectomy. Which of the following interventions should the nurse prioritize to prevent postoperative complications? A. Encourage deep breathing and coughing exercises. B. Administer analgesics as prescribed. C. Ensure the patient's diet includes high-fiber foods. D. Assist the patient with leg exercises every hour. Answer. A. Encourage deep breathing and coughing exercises. Rationale. Deep breathing and coughing exercises help prevent atelectasis and pneumonia, which are common postoperative complications. 184. A nurse is caring for a patient with a history of alcohol abuse who is experiencing withdrawal symptoms. Which of the following findings should the nurse prioritize? A. Tremors and restlessness. B. Diaphoresis and nausea. C. Hypertension and tachycardia. D. Delirium and hallucinations. Answer. D. Delirium and hallucinations. Rationale. Delirium and hallucinations are severe symptoms of alcohol withdrawal and indicate the need for immediate intervention to prevent further complications. 185. A nurse is caring for a patient with a history of asthma who is experiencing an acute exacerbation. Which of the following interventions should the nurse prioritize? A. Administer a short-acting beta-agonist, SABA, inhaler. B. Administer a corticosteroid inhaler. C. Encourage the patient to perform pursed lip breathing. D. Increase the oxygen flow rate to 4 liters per minute. Answer. A. Administer a short-acting beta-agonist, SABA, inhaler. Rationale: a short-acting beta-agonist, SABA, inhaler is the first-line treatment for acute asthma exacerbations to relieve bronchospasm and improve airflow. 186. A nurse is caring for a patient who has just been admitted for acute respiratory distress syndrome, ARDS. Which of the following actions should the nurse prioritize? A. Administer prescribed diuretics. B. Position the patient in a high Fowler's position. C. Provide supplemental oxygen as prescribed. D. Monitor blood gas levels every hour. Answer: C. Provide supplemental oxygen as prescribed. Rationale: oxygen therapy is crucial in managing ARDS to maintain adequate oxygenation and prevent further hypoxemia. 187. A nurse is caring for a patient with a central venous catheter, CVC, who has developed a fever and chills. Which of the following actions should the nurse take first? A. Draw blood cultures from the CVC and peripheral site. B. Increase the flow rate of 4 fluids to maintain hydration. C. Administer prescribed antipyretics to reduce fever. D. Remove the CVC immediately and notify the healthcare provider. Answer: A. Draw blood cultures from the CVC and peripheral site. Rationale: the nurse should draw blood cultures to identify any possible infection associated with the CVC before taking further actions. 188. A nurse is caring for a patient who has been prescribed warfarin. Which of the following lab values should the nurse monitor closely? A. Hemoglobin and hematocrit levels. B. Prothrombin time, PT, and international normalized ratio, INR. C. Blood urea nitrogen, BUN, and creatinine levels. D. Serum albumin and total protein levels. Answer: B. Prothrombin time, PT, and international normalized ratio, INR. Rationale: warfarin is an anticoagulant, and monitoring PT and INR is essential to ensure the patient's blood is appropriately thin to prevent clotting. 189. A nurse is caring for a patient who has undergone a total knee replacement. Which of the following interventions should the nurse prioritize to prevent complications? A. Encourage the patient to perform leg exercises. B. Apply ice to the knee joint for 20 minutes every hour. C. Encourage the patient to use a continuous passive motion (CPM) machine. D. Assist the patient in turning and repositioning every 2 hours. Answer: A. Encourage the patient to perform leg exercises. Rationale: leg exercises are essential to prevent complications such as deep vein thrombosis, DVT, and improve circulation after a total knee replacement. 190. A nurse is caring for a patient with a suspected myocardial infarction, MI. Which of the following actions should the nurse take first? A. Administer oxygen as prescribed. B. Prepare for possible thrombolytic therapy. C. Obtain a 12-lead electrocardiogram, ECG. D. Assess the patient's pain level. Answer: A. Administer oxygen as prescribed. Rationale: oxygen is the first intervention to ensure adequate oxygenation and prevent further myocardial damage during a suspected MI. 191. A nurse is caring for a patient who has been prescribed an antipsychotic medication. Which of the following side effects should the nurse monitor for closely? A. Drowsiness and lethargy. B. Increased appetite and weight gain. C. Tremors and rigidity. D. Dry mouth and constipation. Answer: C. Tremors and rigidity. Rationale: antipsychotic medications can cause extrapyramidal side effects such as tremors and rigidity, which should be monitored closely. 192. A nurse is caring for a patient who has developed a pressure ulcer. Which of the following is the most important factor in promoting wound healing? A. Applying a dry dressing to the wound daily. B. Ensuring proper nutrition with adequate protein intake. C. Using an antimicrobial ointment to prevent infection. D. Keeping the wound covered with a transparent dressing. Answer: B. Ensuring proper nutrition with adequate protein intake. Rationale: adequate nutrition, especially protein, is essential for wound healing by promoting tissue repair and cell regeneration. 193. A nurse is caring for a patient who has been diagnosed with hyperthyroidism. Which of the following symptoms should the nurse monitor for closely? A. Bradycardia and weight gain. B. Increased appetite and weight loss. C. Cold intolerance and constipation. D. Decreased blood pressure and lethargy. Answer: B. Increased appetite and weight loss. Rationale: hyperthyroidism typically causes symptoms such as increased appetite, weight loss, and tachycardia due to an overactive thyroid. 194. A nurse is caring for a patient with pneumonia. Which of the following interventions should the nurse prioritize to improve oxygenation? A. Administer prescribed antibiotics. B. Provide supplemental oxygen as prescribed. C. Encourage the patient to drink plenty of fluids. D. Perform chest physiotherapy as prescribed. Answer: B. Provide supplemental oxygen as prescribed. Rationale: oxygen therapy is crucial to improve oxygenation and prevent hypoxemia in patients with pneumonia. 195. A nurse is caring for a patient who is receiving 4 potassium. The nurse notices that the 4 site is red and swollen. What is the nurse's priority action? A. Stop the infusion and remove the 4. B. Increase the flow rate of the 4. C. Apply warm compresses to the 4 site. D. Document the findings and continue the infusion. Answer: A. Stop the infusion and remove the 4. Rationale: redness and swelling at the 4 site can indicate infiltration or phlebitis, so the first action is to stop the infusion and remove the 4 to prevent further complications. 196. A nurse is teaching a patient about managing hypertension with lifestyle changes. Which of the following should the nurse include in the teaching plan? A. You should avoid all sources of caffeine. B. Limit alcohol intake to no more than 2 drinks per day. C. Engage in high-intensity exercise for at least 30 minutes daily. D. Increase your sodium intake to ensure proper fluid balance. Answer: B. Limit alcohol intake to no more than 2 drinks per day. Rationale: limiting alcohol intake is recommended for managing hypertension. Excess alcohol can increase blood pressure. 197. A nurse is caring for a patient who is scheduled for a colonoscopy. Which of the following should the nurse instruct the patient to avoid before the procedure? A. Drinking clear liquids. B. Taking prescribed medications. C. Eating solid food. D. Using an enema. Answer: C. Eating solid food. Rationale: patients should avoid solid food before a colonoscopy to ensure the colon is clear for the procedure. 198. A nurse is caring for a patient with diabetes mellitus who is experiencing hypoglycemia. Which of the following actions should the nurse take first? A. Administer an oral glucose tablet. B. Call for assistance from the healthcare provider. C. Administer insulin as prescribed. D. Encourage the patient to drink water. Answer: A. Administer an oral glucose tablet. Rationale: the first action for hypoglycemia is to administer a fast-acting carbohydrate, such as an oral glucose tablet, to quickly raise the patient's blood sugar. 199. A nurse is caring for a patient who has just undergone a total hip replacement. Which of the following interventions should the nurse prioritize to prevent complications? A. Maintain the patient in a supine position. B. Apply a continuous passive motion (CPM) machine to the affected hip. C. Encourage the patient to perform leg exercises. D. Restrict the patient's fluid intake to prevent swelling. Answer: C. Encourage the patient to perform leg exercises. Rationale: leg exercises help prevent complications such as deep vein thrombosis, DVT, and promote circulation following surgery. 200. A nurse is caring for a patient who is receiving an opioid analgesic for pain management. Which of the following is the nurse's priority assessment? A. Heart rate and rhythm. B. Respiratory rate and oxygen saturation. C. Bowel sounds and abdominal distension. D. Skin temperature and color. Answer: B. Respiratory rate and oxygen saturation. Rationale: opioid analgesics can cause respiratory depression, so it is important to monitor the respiratory rate and oxygen saturation to ensure the patient is breathing effectively.